All right, so we are live now. We just wait for 30 seconds for all the people to join in. Okay, so good evening, and I welcome you all to another session of our Monday slide seminars with Dr. Borges. Our presenter today, of course, is Dr. Anita Borges. She is the lab director and consultant pathologist at Center for Oncopathology, supported by Tata Trust at Mumbai. And the theme of today's slide seminar is Tweedledum and Tweedledee. As we now, you may well know, in this slide seminars, we invite 4 residents to join us in the live interaction. So today we have Dr. Sumana Biswas. She's a PGY3 from North Bengal Medical College, Siliguri. We have Dr. Insha Mustaq Bande. She's a PGY2 from the Sher-e Kashmir Institute of Medical Science at Srinagar. We have Dr. Vigneshwara Murthy. He's a PGY3 from SMBMC Puducherry. And we have Dr. Prashant Ghimire. He's joining us from UCMS Nepal. The session will be moderated by me, Gaurav. I am an assistant professor at Hematopathology Lab here at ACTREC, Tata Memorial Center, Mumbai. And the webinar is hosted, as always, by Dr. Sumit Gujral. So for those of you who are new to our slide seminars, in this, Dr. Borges will directly go live with Sumana, Insha, Vignesh, and Prashant. For all of you, you can interact in the chat session and you can ask questions. And my job is to take those questions back to Dr. Borges so that it can be a very interactive session. So I encourage you all to ask questions and keep interacting in the chat session. These are some of our routine disclaimers. Few more, just to emphasize that because this is a slide seminar, the digitized slides are the proprietary property of the presenter. Any unauthorized reproduction of the same is prohibited. So with this, we are ready to start our slide seminar. Just launch the slide. All yours, ma'am. Okay, I think there's some issue with ma'am's connections. We'll wait for 1 or 2 minutes for ma'am to join in. In the meantime, can you all introduce yourself? Sumana, where are you from?
Okay, Gaurav.
Yes,
for
ma'am.
a while I got disconnected, but anyway, I think
you can start.
I will try.
Yes.
Yes, I will start. Okay. Yeah, everybody can see this, right? You must be able to see the screen. Are you able to see it? Can everybody see the screen? Can you hear me?
Yes, ma'am. We can
you
hear
me, Gaurav?
Yeah.
Yes, all of you can hear me? All right, good. All right, now this is a slide seminar, and I've called it Tweedledum and Tweedledee. Okay. Did anybody, you saw all you knew that it was called Tweedledum and Tweedledee. And were you curious enough to wonder why this was called Tweedledum and Tweedledee? Any one of you? I can only see 2 of you. The other 2 seem to have some problem. So I can see Vignesh over there. Vignesh, did you find out about Tweedledum and Tweedledee?
Yes, ma'am. It's I think it's a poem. It will be looking like identical, but they are not same, ma'am.
Yes, but what is the poem? Do you know anything about the poem?
No, ma'am.
No. All right. What about you, Insha?
Yes, ma'am. It's a poem where Tweedledum says Tweedledee that I have something got a new rattle, and they have a battle. So a crow comes in, and then there's a poem that goes like that. But at the end of the battle, it's like the crow comes and spoils everything. So finally, they are left with they like mutually agree that.
Okay. All right. So now here's the poll question for everybody who wants to answer. Yes. Who is it? Jane? Is it Mary? Is it Alice? Is it Anne, or none of the above?
So we have almost 78.
You see, there is a girl, right?
Yeah.
So,
ma'am, almost 79% of the people have answered that it's Alice.
That it's Alice. Sorry, that's very good. So some 7 98% of them, unlike Vignesh and unlike Insha, actually went and checked it out, right? Or they just knew it from beforehand that this is Alice. Okay, so who was Alice? Now they knew it was Alice. Who was Alice? Is Alice a fictional character or is Alice a real girl? Come on, Vignesh. Because you looked it up, you said.
I think it's a fictional character, ma'am.
A fictional character. What about you, Insha? It's either a yes or one or the other. You don't have 5 choices. Come on. Is it a fictional character or a real girl?
A real girl.
Real girl. All right. What about Sumana? Sumana, is it a fictional character or a real girl? Sumana, can you hear me? You know that we talked about Alice.
Ma'am, a fictional character.
Fictional character.
Yes.
All right. Now I can't ask Prashant because I can't see him and I don't know whether he's in the room or out of the room. But what do the polls say?
So 85% have gone with fictional character, ma'am, and 15% said it's a real girl.
Well, Alice is a real girl, okay? And she was known as Alice Pleasance Liddell, okay? Alice was the dean of one of the colleges in Cambridge. You have professors and you have tutors. They still do at Oxford and Cambridge. And Lewis Carroll was a mathematician, and he befriended the daughter of the dean. She was a little girl, and he used to tell her stories. He used to tell her and her siblings stories, and these stories were collected in 2 books, and they were known as Adventures in Wonderland and Through the Looking Glass. And I think that any of you who really want to read a really wonderful piece, it's not just plain and simple fairy stories. There, of course, the stories that he made up were very imaginative, and he made them up about Alice. Okay, and the whole thing starts when Alice is lying in a field on a hot summer's day in England, and a hot summer's day in England appreciated by everybody because it's always raining. And so when you have a hot summer's day, everybody's out, and she was lying in a field and she saw a rabbit cross her path. And the rabbit said to her, "Follow me." And she followed the rabbit. And the rabbit went down a rabbit hole. You know that rabbits live in burrows underground. And she followed the rabbit, and what she found in this world after she followed the rabbit is told in Alice's Adventures in Wonderland. Okay, so these are real. Alice was a real girl, but the stories about her are fictional, and it was made up by Lewis Carroll. And some of these characters from Alice's Adventures, 2 of them you have already met, and that is Tweedledum and Tweedledee. They are like twins. They look very similar, but they are not the same. That's exactly what Vignesh said. Yeah. Now, the top left-hand corner, you can see there are these 2 characters called Walrus and the Carpenter. Okay. Now, the Walrus and the Carpenter was the story that Tweedledum and Tweedledee told Alice. Okay, Alice met them while she was walking in the wood, and these 2, Tweedledum and Tweedledee, told Alice a story, and the story is about the Walrus and the Carpenter. And the Walrus and the Carpenter, you see all the oysters, they were walking along the shore, and you see the oysters over there. You know what are oysters? Anybody knows what are oysters? Yeah, Sumana, you know what is an oyster? Have you ever seen an oyster? No. Vignesh, have you seen an oyster? Ever? You know what is a shellfish?
Yes.
It's a bivalve,
Yes,
and
ma'am.
inside that there is the creature. So you two have ocean comes in and goes out, and inside you have a little creature, and those are known as oysters. And these creatures, their product becomes, a pearl. Did you know that oysters make pearls?
Yes, ma'am.
Yes. Now, of course, there are lots of cultured pearls that are made in factories and labs and so on. But originally, these oysters used to produce these pearls, which were very prized. They still are. To get natural pearls, you get from an oyster. But the creatures inside that are very tasty to eat. And so the walrus, you see this walrus with his big tusk in the front, and a carpenter. Now these are all make-believe characters, but they were very fascinating. And Lewis Carroll used to tell these stories. Okay, now they wanted to eat the oysters, so they started a story, and that story lured these oysters from the ocean where they normally reside and out onto the shore. And on the shore they become vulnerable because they are out of their normal environment. And they tell them the story, and they start to say that they're going to tell them a story of shoes and ships and sealing wax and cabbages and kings. In other words, I'm going to tell you stories about all sorts of things. And finally, when the oysters, very curious to know what are all these stories that the walrus and the carpenter are going to tell them, come and sit around them. And what do you think happens to the oysters? They get eaten by the walrus and the carpenter. All right. So what is the moral of the story? Don't listen to people who are trying to tell you stories. Okay. So, but I'm trying to tell you that you better listen to me because I'm telling you stories. All right. And here I'm sure you've heard the expression, he's a mad hatter. Well, the Mad Hatter comes from also one of the stories that Lewis Carroll wrote. Can you hear me, all of you? Yes, okay. And you see he's got a very tall hat, and he's a very colorful character. And he decides that he should throw a tea party for Alice and a dormouse. And a dormouse is a small little cuddly little mouse that is harmless, and the dormouse goes to sleep during the tea party. All right. And you heard about the Cheshire cat. He said something which we use in medicine or in science. And you know what she said in Alice in Wonderland? It takes all the running you can do to keep in the same place. If you want to get somewhere, you must run at least twice as fast. And you know what that means? It means we can't be complacent or we will fall behind. To survive another day, we have to run very fast and very hard, and we need to co-evolve with the systems that we interact with. And this is something, unfortunately, human beings have not learned. Okay, what are you human beings doing? We are not co-evolving with the environment that we are destroying. And without that environment, I don't think that we would survive. And that's what we talk about, climate change. Okay, now see what Charles Darwin said. Alice was more or less contemporary with Charles Darwin. It said, it is not the strongest of the species that survives, nor the most intelligent, but the one most responsive to change. So, you see what Eric Hoffer said over here? In a time of drastic change, and we are in a time of drastic change, it is the learners who inherit the future. And I see the learners in front of me right here. all the little thumbnails that I can see. Inherit the future. The learned find themselves equipped to live in a world that no longer exists. It's exactly what the Red Queen said. To run twice as fast, okay, to stay in the same place, which means you cannot stop learning. You have to keep on and on, otherwise you'll find that you have been left behind. All right, so we talked about Charles Darwin and evolution. So now here's the next poll. What's the poll now? Put it up, Gaurav.
Yes, ma'am. Yes, we have
Yes,
already.
good. Sorry. Yes. What is the poll? You can see.
Yes,
All
ma'am.
the following.
So,
Yes.
so almost 81% of them went with giant panda.
Very good. And why not the beagle? The beagle? What is the beagle? Well, here I'll tell you. Yes, Charles Darwin never ever wrote about the giant panda because Charles Darwin never visited China. Okay, the beagle is an animal, but Charles Darwin went on a sea voyage as a naturalist to collect species from different parts of the world. And you can see here the the voyage that Charles Darwin made. Started in Plymouth, went all the way down around around the southern tip of South America, then across the Pacific Ocean to Sydney, then round from Sydney, Tasmania, then he went all the way around to the Indonesian islands, around the Cape of Good Hope and back to Plymouth. And all the way, he collected lots and lots of species. And when he was in these islands, and you can see that over here, the Galapagos Islands, he noticed something very interesting. And he noticed that there were these giant tortoises, okay? Galapagos Islands. And on those Galapagos Islands, each island had a different kind of bunches. They were all tortoises. How is it that you have these giant animals and each of them is different? They are different species, all separate. Just this big expanse of ocean between these islands, okay? And the last tortoise, and these tortoises used to live for 200 or more years, and the last tortoise on one of the islands was the only tortoise of his species on that island, was known as Lonesome George, because Lonesome George had no mate. Okay, so yes, there were giant tortoises and or finches. Okay, finches are a kind of bird, but if you notice, again, the finches had different beaks, and they were all in the Galapagos Islands. But on different islands, you had different finches, and each of them had different beaks. And from this, when Charles Darwin came back to England, he thought about this a lot, and then came up with his.
Your voice is breaking.
Yes, I know that. Please. Who's telling you that?
Sumit.
Sumit, okay. I can't help it. What to do? Open the door, nuts.
Oh, you keep it open?
Yes. So, can you hear me now, or is my voice breaking?
We can hear
It's
you
clear, it's
for the
clear.
most of the time clearly. Little bit times it is breaking.
Yeah. All right. So then these are the finches, and he came up with his, history selection and the theory of evolution. Okay. So we'll go now to the cases. And who wants to take the first case? All right, I will go in order of how I can see you guys. Yeah. So Vignesh, you want to take this first set of cases? Now we have Tweedledum and Tweedledee. Yes, 1A and 1B. Come on, Vignesh.
18-year-old male
Can
patient.
you read 1A and 1B?
Yes, ma'am. Case 1A is 18-year-old male, wide local excision of a tongue lesion.
Okay, and 1B?
1B is 44-year-old female, distal pancreatectomy, ma'am.
All right, good. Come on.
Yes, ma'am. In
Yes,
case
you have to describe 1A and 1B.
yes, ma'am. In 1A, I can see few papillae-like structures which is arising from the surface of the surface epithelium, ma'am. And then this surface epithelium is being lined by a stratified epithelium and shows some central cores, some central core which is made up of fibrocollagenous material having some clear areas, ma'am.
Having some clear areas.
Yes, ma'am.
All right, and what about 1B?
In case of 1B, since it is a pancreatic, distal pancreatectomy, I can see a normal pancreas at the right corner.
Okay.
Adjacent to it, there's some well-defined multiloculated system or multiple system, which have been separated by some normal tissues, which is made up of fibrous material. This distribution shows some
All right. Vignesh, you're supposed to see something at low power, right? So what do you see? You know the theme of this slide seminar, right? And the theme of the slide seminar is Tweedledum and Tweedledee. You are the one who told me that who are these Tweedledum and Tweedledee? Okay, they were two characters, and we have discussed that it came from Alice in Wonderland. I think it was probably from Through the Looking Glass and not Alice in Wonderland, the second book. And they look similar, but they are not the same. Okay, very good. Now, if you know that, and you're telling me that in 1B that there are some, what did you call these things? Let us see the whiteboard. Okay. Right. What did you call these things? Sorry, I think they are on top of it, so I can't move the... Right, okay. Good. So what did you call these things?
Excuse me, ma'am. I can't hear you. No, I can't hear properly.
I lost connection.
It's back on now.
Sorry?
Ma'am.
It's back on?
Yeah.
All right. Very good. All right, Vignesh, I'm so sorry, but I have to do with a bad connection today. Yes, what is this?
These are many cysts.
What are these structures? Many cysts.
Yes,
what did you say here? You said you saw something, these papillary-like projections, and you said you saw some what? What did you describe?
I see some normal pancreatic areas here, ma'am.
No. I'm talking about 1A.
1A. Yes, yes, ma'am. I can see few papillary-like structures, ma'am.
Yes, and
tongue, which is lined by
squamous epithelium.
Yes,
okay,
ma'am. These are lined by squamous epithelium. Yes, ma'am. And then at the center, I can see some fibrocollagenous central core, ma'am. And also, they are having few
fibrocollagenous tissue. Okay. Can you show me where is the central core of fibrocollagenous tissue? Can you take your pen and draw? Central core of fibrocollagenous tissue. That's what you think. All right. And what about this? Is this also central core of fibrocollagenous tissue? What about this? And what is this?
They are dilated cystic spaces, ma'am.
Aha. So, I think you can make out even at this part, all right, that there is something similar between the two. Yes or no?
Yes, ma'am.
Here we are seeing cysts, and here too we are seeing cysts.
Yes, ma'am.
Yes, you can see the cystic spaces, and you can see some coagulated material over here. Here, you don't see much coagulated material, but there is some light flimsy kind of material that is present within the cysts. Now you can see them even better. Yes or no?
Yes, ma'am. I can see, ma'am.
There you see some cystic spaces. You do? Yes. So will you describe
Yes,
them,
ma'am,
please? And you describe what you're seeing in.
Yes, ma'am. In 1A, I can see I can see that the squamous epithelium very clearly, ma'am. In that center, I can see few scattered infiltration of brown blue cells, ma'am. It is seen in aggregates. Along with that, many dilated spaces, ma'am, of variable size and shapes, ma'am.
What is the variable size and shape?
Ma'am,
what do you see that is a variable size and shape?
Cystic spaces, ma'am.
Cystic spaces. All right. So in the center of what you are describing as papillary excrescences, yes, there are these spaces which have got some coagulated material in them. Can you see them? You can see them even here on the surface of the where the squamous epithelium is very attenuated. Yes.
Yes, ma'am.
All right. Okay. So that's what we see in this. Okay. So now this is a little higher power. Come on,
Yes.
Vignesh.
Yes, ma'am. In 1A, I can see this infiltration is made up of mostly of lymphocytes, ma'am. Along with that, in 1B, I can see few intraluminal papillary-like projection, ma'am, finger-like projection, ma'am.
So what did you say about 1A, Vignesh? You saw some lymphocytes.
Yes, ma'am. I can see these lymphocytes are surrounding.
I didn't understand.
Yes,
the surrounding tissue has got lymphocytes. Okay.
Yes, ma'am. These lymphocytes are seen around that cystic spaces, ma'am, in 1A.
Okay.
Whereas in 1B, I can see these cystic spaces having some intraluminal finger-like projections, ma'am.
Okay. All right. Both cases. All right. Here.
And then in 1B, I can see these cystic spaces are lined by flattened cells, ma'am. And then also I can see some artificial cleft-like areas, ma'am.
Artificial?
The clefting areas, ma'am. Some cleft-like spaces, ma'am.
Clefting, artificial clefting. Where is that artificial clefting? You mean these are artificial clefts?
Yes, ma'am. This one, ma'am.
There. Oh, I see. There's artificial. Would you like to say what is that artificial clefting?
It may be due to processing effect, ma'am.
What effect?
Due to processing effect or
processing effect. All right. Everybody sees what he has circled. You saw that, no? Where he's put a red mark. All right. So now, Insha, what is this artificial clefting that he's talking about? I'll clear it so that you can see. What is that artificial clefting he's talking about?
Ma'am, I think it's just lymph that is present. Lymph, some pale eosinophilic material. It's lymph, basically.
You think it's lymph? Okay. And? So what is this artificial clefting that he's talking about? Is Prashant wanting to answer that question? Prashant, can you see this artificial clefting?
Yes, ma'am. Yes, ma'am. That could be due to the processing effect, ma'am.
Prashant? Sorry? This artificial clefting that he's talking about. Yes, would you like to describe it, Vignesh? That this artificial clefting, what is it?
Ma'am, these are pale eosinophilic-like material, ma'am.
Okay.
Possibly of lymph secretion, ma'am. Lymph.
No, that may be whatever it is, but what is your artificial clefting?
Yes, ma'am. I can see some irregular cleft-like spaces in between that secretions, ma'am.
Cleft, they're actually slits, isn't it?
Yes, ma'am. Slit.
Yeah.
Yes, ma'am.
Yes. Okay. So, but why is it there? Sumana, why? You can hear me, Sumana?
Yes, ma'am.
All right, so tell me.
Ma'am,
Why?
ma'am, this is a lymph fluid. The area
I don't
showing the
want to
lymph
know
fluid.
what there is. He said he saw artificial clefting. Can you see what he means? That there are parallel lines that look like slits. They
Yes, ma'am.
are, yes, it looks as if there is nothing there. These are slits which are parallel to the, okay, right throughout this rather pink material that is present in this, inside these cystic spaces. So what has made those parallel clear lines or slits? What has made it? Insha? Vignesh said it was a processing artifact. Is that what you said, Vignesh?
Yes, ma'am. It can be.
Yes. So what processing artifact? What? Alcohol? Xylene? Formalin? What? Wax? Now don't, if you say processing artifact, then you have to explain what processing.
Yes, ma'am.
Processing. What are the steps of processing? Because you said processing. Now you have to tell me what steps of processing and what has caused that processing artifact. So what are the steps of processing, Vignesh?
Fixation, ma'am.
Fixation, all right. Strictly speaking, it is fixation is fixation, but that's all right. All right, so fixation. So that's a formalin bath, right? Okay,
Yes, ma'am.
next. What kind of processor do you have in your institute, Vignesh? Vignesh has disappeared.
Ma'am, dehydration.
Yeah. What do you know? Do you know the name of the processor in your institute, Vignesh? Do you know the make of the processor?
I think it's manual processing machine. Company name is automated. Automated processing machine. It's called as from Leica company, ma'am. I think.
Leica, all right. And it's Leica, it's not manual.
That's
It
no
cannot be
automated. Sorry,
manual.
automated.
Okay, it's Leica, all right. So your first bath is formalin. Is it one of those that is a rotary system? Is it a rotary system? Yeah.
Yes, ma'am. It's a rotary.
So
Automated.
and you have these buckets which then
Yes.
go and dip and then go round again. Is that the system? Okay,
Yes,
very
ma'am.
good. Right. So what's the next bucket after formalin?
Then dehydration, ma'am.
I understand, but what is in that bucket? What is inside that container into which the bucket dips?
Into 90%, 80%, 70% alcohols, ma'am. And
So it starts with 90% and then 80% and then 70%. Is that right?
ascending order, ma'am. It goes in ascending order.
Okay. So which alcohol are you using? Methyl alcohol, ethyl alcohol, butyl alcohol, isopropyl.
Isopropyl alcohol, ma'am.
All right. So in isopropyl alcohol, you're using 70%, 80%, 90% of isopropyl. Are you sure?
Yes, ma'am.
I don't think you're sure.
I'm sure, ma'am.
Huh? You're sure? So you
Yes,
mean
ma'am.
you get isopropyl alcohol in so many percentages, is it?
Yes,
When
ma'am.
did you last go and talk to your technologist?
I think it's about 1 week, ma'am. 1 or 2 weeks, ma'am.
1 or 2 weeks ago, and your technician told you he's using 90% or whatever it is, 60% ethyl, isopropyl alcohol. Yeah, you think so? Yes, what about you, Insha? What do you use? What do you use?
I think it's ethyl alcohol.
What alcohol? Do you use isopropyl
Sorry, ma'am.
alcohol? Can you
I think
isopropyl
it's ethyl.
alcohol? You use ethyl alcohol. Okay. All throughout? How many jars do you have? 1 jar, 2 jar, 3 jars of alcohol, or 4 jars? 3 jars.
3
And what's in the
jars.
3 jars? Yeah, so what's in them?
Different concentrations. The concentration of alcohol varies.
Yeah, but tell me, what percentage? We
90.
don't know. 90.
I don't know, ma'am.
I
70
think
and 50, I guess.
yes. So I think that we are all very, very happy to talk about processing defects and cutting defects, but we don't even know what the process is. Okay, so now that's what I was asking Vignesh. Forget about which processing point did you get that artifact? What is it? Formalin? Forget about which percentage. Is it formalin? Is it ethyl alcohol? If you're using propyl alcohol, is it xylene? Is it wax? Where did you get that? At which stage in processing?
This defect can be from xylene or can be
from xylene,
or it can be from wax, ma'am.
Yeah, you're guessing. You're guessing. Come on, Insha. Where did you get that defect from? If it is a defect, is it real or an artifact?
I think, I don't know, ma'am. All this discussion on artifact now, I think it's an artifact.
Come on. Yeah, so it's high time you did. Okay. Come on, Sumanna.
Ma'am, most probably this is due to at the time of cutting in microtome.
Excellent, Sumanna. It is not a processing artifact. It is a cutting artifact, right? It's a chatter. Okay. Yes, it's a chatter. And why do you get a chatter? Why do you get these lines?
Ma'am, when the blade of the microtome is not properly sharpened, or there may be some difficulty, that's why the shattering artifact is occur.
Yes, it does. And there is a particular reason why it does this in something that is dense and is pink like this. Okay, what do you think this pink is, right? Okay, it's lymph, but what is lymph made of? It is coagulated, right? This material is coagulated. So it is a coagulum. And in this coagulum, do you know what a coagulum is like? It's a jelly-like proteinaceous material, okay? And that may not get properly infiltrated by wax. And that's why when you start cutting that, there is a differential plane between your blade and the different consistencies in that. And you get shearing. It is actually not a cut in that coagulum. So this is a shearing artifact that occurs at the time of cutting. Yes, and to some extent, Vignesh was right, because this does not get adequately with wax, and then you get this shearing effect. So this is not about xylene, this is not about alcohol, it's how it gets permeated with wax, and then the shearing effect that takes place. All right, very good. So this is an artifact, okay? And what are you seeing here in 1B?
Mama,
What's there in 1B?
Mama, in that 1B, I can see some intraluminal papillary-like projections, Mama. Along with that, this cystic spaces are filled with some eosinophilic material, ma'am.
All right. So you see some papillary projections. All right. So have you guys reached some kind of Diagnosis? Any diagnosis
Yes, ma'am.
Yes,
that
ma'am.
anybody wants to put up? Maybe people in the chat room or anything would like to put up some diagnoses. And what
Ma'am,
is
I
your
have a
diagnosis,
doubt.
Vignesh?
Mama, in one
Who has a
A,
doubt? Okay, 1 minute. Let him say what. Yes, in 1A.
in one A, it's about a lymphangioma, ma'am.
Lymphangioma. Very good. And in 1B?
In one B, it's I think about the serous adenoma, ma'am, of pancreas.
Excellent. All right. Now, Insha has a doubt. What is your doubt, Insha?
Ma'am, if those white spaces that we were telling is like those sharp white
Sharing.
spaces are because of cutting artifact, then other
Yes.
than the lymph, those cystically dilated spaces show us a pale pink material, but they also show us some white spaces also, other than those.
So you tell me,
So
what is
what is
that?
that
What is
because of?
that due to? 1 second. I'll just go back. So you can tell me. Yes, these spaces. Somebody has marked it. Yes.
Yes, ma'am. Like if that was because of the artifact, then what is this space because of? These white
So you
spaces
tell
are.
me. Since you thought about it, you tell me. What is it?
For me, I was earlier only thinking of the fact that there is stasis of lymph basically
Okay.
that is
Very good.
happened. So when there's stasis of lymph, now I'm coming to the point that the whole of the space should be occupied by lymph. Lymph, why is a bit of
Right. So let
some
us ask
places are
your
devoid of lymph.
colleagues. Come on. Now, Sumana, you please
Yes,
tell
ma'am.
her, why are there these spaces? They should all be pink. Why are they white?
Ma'am, this area showing pink because the pinkish material is coagulation-like material. That's why
Yes.
they are stasis. And
No,
the
she's
upper,
asking why are there white spaces? This. In the middle of those cystically dilated areas,
yes,
there
ma'am.
is a rim. You can see that there is a rim, thick or thin rim, yes, of this
Yes.
coagulated material. And then you have, see, in this face, it's a rim. It's all sticking to the periphery, and there is a white space in between. So now you explain that. That's what she's asking. Anybody?
Ma'am, then probably the lymph, since it's a coagulable material, gets adhered to the wall of the lymphatic channel wall, and probably that's why I'm assuming that's why we get a space in the center.
Yes. Yes, so what happened? Can you hear me, or is my voice cracking?
We can hear you, ma'am.
My voice is cracking. You can hear me? Yes, all right. So now you tell me, you were saying something.
Yes, ma'am. Probably now I'm assuming that the lymph, that is a coagulum-like material, has got adhered to the west wall of the lymphatic channel, and
Ah,
because of that,
so
the center
yes.
is probably empty, and that comes as an empty space.
So how does it get?
Ma'am, I think we lost you for a little bit moment. Are you back? Hello, ma'am. Can you hear us? Okay. In the meantime, can you go on describing, Insha, what you're saying, like why these white spaces are there, you think, right now? Insha, can you start describing? You are muted, I think.
Yeah, I don't know. I was asking, ma'am was basically trying to explain what that was, so I thought
No, you were
I
explaining something, right? Like about the white spaces. Why do you think there was those white spaces?
yeah, I was thinking because since ma'am described that it's in the center of this pale eosinophilic material, so I was thinking maybe the lymph has got adherent to the walls of the lymphatic channel, and that's why the space has been created in the center.
What do you think, Vignesh and Sumana? Vignesh is, I think, agreeing with you, Insha. What do you think, Vignesh? Vignesh, you are muted, I think. Vignesh, can you hear me?
Yes, sir. I can hear you, sir.
Yeah. So what do you think about that? You were, I think, agreeing with Insha?
Yes, sir. I'm agreeing with you.
Okay. And what about you, Sumana?
Sir, most probably this is at the time of cutting, the lymph fluid is lymph fluid was stasis because it's a coagulum property. That's why at the time of cutting, this area show clear.
Okay, fine. So you
Most probably it was deposited. That's
yes.
why.
So it's basically retraction of the normal the coagulum material, right? So that always happens during processing, right? You will have some area of the cystic space which will be the material will be retracted to one end, so you'll always have those white spaces. Is it clear now? Okay. So ma'am, are you back now? I can see her, but I don't think she can hear us. Okay, so in the meantime, we can go to the next slide because you have already given your diagnosis, but you know there is an approach that ma'am follows to any diagnosis, right? So Vignesh, if you're there, can you go on one by one? So if you're discussing case 1A, so can you take all of these questions and start discussing? So what will be the answer of the first question for case 1A? Is there any normal tissue present that you could see?
Yes, sir. I can see, sir. Some normal tissues I can see.
Okay, and what was those normal tissue?
They're about squamous mucus, that stratified epithelium, sir. Squamous epithelium.
Okay. And could you see any abnormality in that slide?
Yes, sir. I can see there are some cystic spaces, sir. Dilated cystic spaces.
So the dilated cystic spaces were the abnormality, right?
Yes, sir.
And what do you think is the relationship of the normal to the abnormal? Could you find in relationship any distribution, any pattern of the abnormality to the normal?
No, sir. I can see any pattern, sir. I can see this randomly placed cystic spaces, sir.
So if you can at least say that where they were present, right? Like for example, the cystic spaces were present in the subepithelium. So that's a pattern, right?
Yes, sir.
Yeah. So that's very important that you note that where the abnormal tissues were present, right?
Yes, sir.
And then if you go to the fourth question, is there a pattern to the abnormality itself? Like what was the pattern of that abnormality?
Beneath the subep.
Yes, Vignesh. So the pattern of the abnormality.
Yes, sir. Many multiple cysts, especially in subepithelial region.
Okay, so like you said, that those are dilated cystic spaces.
Yes, sir.
Okay, and if you were to direct your hyper-examination, where you would have done that?
On the cystics, on the wall of the cyst and along the periphery of the cystic wall, so adjacent to the cyst.
Yes, so the lining of the cyst, especially, like
Yes.
we saw those pictures in the lining of the cyst, right? So those are the places where you did. In the meantime, I got a call from ma'am, so she's coming back within maybe 2 or 3 minutes.
Yes.
So what about the case 1B? Do you want to take those questions, Insha, for case 1B? You can go one by one. Yeah.
Yes, sir. Is normal tissue or structure present? Yes, that was the pancreatic acidic tissue that was present, normal pancreas.
You can go by one by one, Insha. So okay, so you think the pancreas tissue was the normal, right? So then the second question,
Yes,
please.
sir. Abnormalities were the cystically dilated spaces that were present.
Okay. Then next, go on. Please go on.
Relationship of the normal to the abnormal tissue. It was present.
Yes, go on.
Outside the connective tissue of near the parenchyma of the pancreas.
Okay.
Pattern is the same, so it's cystically dilated spaces.
So the fact that the lesion was the abnormal tissue was totally demarcated from the pancreas, right? So it was not that it was
Yes.
intermingled. It was the abnormal tissue was quite demarcated,
Separate
right?
from the pancreas.
and the abnormality for both the slides, as you can see, were the same. So that is why I think it was called as Tweedledum and Tweedledee, because they looked very same to each other. And then in this case also, you would have
Lining.
to the lining of the cyst, right?
Lining of the cyst.
Yes, great. Okay. So maybe we can go to the scheme now, the scheme of diagnosis, right? So in this, if you put the slides in the context of the clinical picture as well as the analysis, so these are the questions that we will ask, right? So let's start with one by one. Vignesh, you can take the questions. Do you think the first question, what will be the answer? Do you think it's a congenital lesion or acquired?
Maybe acquired, sir.
Okay, let me run a poll side by side and see what the audience thinks. Okay, so you think it's an acquired lesion, is it?
Yes, sir.
Okay, I will just wait for 20 seconds to see what the audience thinks. It seems the audience is pretty divided in this 50-50. I'll end the poll now. Okay. So what about the lining of the cystic space in this? So this all could have been the lining, and you saw the endothelium in this, right? On the lymphatic spaces. So the first question, the answer is acquired, right? You rightly said that the spaces where the abnormality was acquired. So the next question will be, if it's acquired, is it physiological or pathological? What do you think, Vignesh?
It is pathological, sir.
Okay, let me run a poll side by side and see what the audience thinks. Okay, it looks like it's totally, we have a majority, 90% of the people are with you, Vignesh. They think it's pathological, which is probably right. So next, what do you think about whether it's neoplastic or non-neoplastic? What do you think about this?
It's a neoplastic condition.
It's a neoplastic condition, you think? Okay. Let me run a poll with this again. The people are complaining that I'm ending the poll too fast. This time I'll be a little bit. Yeah, let me run this. Okay, so ma'am has some problem joining in. So what I will do is I will just go out for 1 minute and try to sort this out. So in the meantime, I want all of you to just be there, and the audience as well. Like, please hold on. We are trying to get ma'am back. We should be able to do that within a minute. So I will have to go out and bring ma'am back. So just stay here, and you can discuss among yourselves also if you want. Just stay here, basically.
Oh, there we are. Okay. Whiteboard. All right. Can you see me, guys? Am I on now?
Yeah, ma'am.
Can you hear me? Oh,
Yes,
okay.
ma'am.
Very good. I think Gaurav was doing a very good job. Okay, so we reached this point of neoplastic or non-neoplastic. Yes. But before that, we were just having a little conversation about. All right, can you see me, guys? There's a lag, Gaurav. Say my whole voice is coming back. Gaurav, are you there?
Yes, ma'am. I'm back. I'm back. Yeah.
All right. Are you? You know what?
Yes.
There is a lag. There's a very bad lag, and I think it's my bad connection, Gaurav. Yeah.
Now, can you hear me, ma'am?
Yes, I can hear you, but no, this is the lag, Gaurav.
Yeah. It's okay, ma'am. I think. Have you joined through another connection as well?
No, from another connection, yes.
Okay. Well, you can go ahead, ma'am. I think because I can hear you all right. I think Vignesh and Insha, can you hear, ma'am? All right.
Yes,
Oh,
ma'am.
I
We can
can
hear, ma'am.
hear.
Yeah.
Yeah, ma'am. We can hear, ma'am.
We can.
No. What's happening is I hear my words back.
Yeah, there is an echo from someone's end. Can you all mute yourself, please? All of the students.
I don't think that's the problem, Gaurav.
Yeah. Okay. Can you hear it back again right now, also, ma'am? Yeah.
All right. Can I? Can
Ma'am, there are a lot of people are they can hear you all right.
I know they can. That's all right. I'm very happy. We were discussing something about these spaces, and there was somebody in the chat box who I think it was Neha. Oh, you know.
Ma'am, have you by any chance joined from two different system? No, no, only one laptop you have joined. Only one desktop.
No, there's Gaurav. There are too many. Let me just talk to Gaurav on the phone. No, I don't. Yeah, only one laptop, Gaurav, and I've gone. Let me just do one thing again. I'll shut everything down and start again. Okay.
Yes, ma'am. Are you back?
How will that work?
See, it's not. All right, Gaurav, I'm back.
Yes, ma'am. We can hear you all right.
Yeah, and I don't have an echo now.
Yeah. We can then start, ma'am.
All right, so then I think we can.
Video.
we can start.
Video.
You want me to turn on the video? Maybe that this way.
Yeah.
All right. Okay.
Yes, ma'am.
Now you can hear me.
Yes. All right, ma'am. Perfect.
All right. Okay. Very good. So whatever time we have, and really we've wasted a lot of time. And if we're not able to do everything today, I'm willing to come at any other time that is necessary. Okay. If the students still want. Okay, so we were discussing this business of, and Neha, is Neha over there somewhere in the chat box? And she said, Neha says, yes, ma'am. Well, she said that this was a drying artifact, and it is true. When you have dehydration going on, and you have something that is got a lot of proteinaceous material, you'll often find that this takes off the dehydration, takes away the water content of this proteinaceous secretion, and it dries. And when it dries, it goes and sticks against the wall of the cystic space, or you've seen it in other conditions. It just like what you see in colloid, in the thyroid. Have you noticed what happens to colloid? Colloid shrinks and then it sits in the center. So either the colloid will go and stick at the periphery. It depends on what is the water content of that material, or it will shrink and become a very viscid thing that sits in the center. So that's the answer to your question, Insha. Okay, that why do you get these kind of spaces? Okay, so Gaurav was very, very nicely taking you through this thing, and the question was, is this neoplastic or non-neoplastic, right? And what most of you said, I think, Gaurav, I heard you say that it is neoplastic, right?
Yes, ma'am. Almost 65%, I think.
Yes. Okay. So the question in this case is, what is neoplasia? Is it? If it is neoplasia, it means that this is like a proliferation of cells in this tissue, or is it just a dilated space? And in which case it is an ectasia, or it is an oma, and that is the problem that you have to solve in this particular case. And I don't think it is easy. Okay, so some of you who said it was neoplastic could be right. Some of you who said that it is a non-neoplastic are also right. Okay, you see cystic spaces in so many organs and tissues, and we don't necessarily think of all of them as being neoplastic. Have you seen Swiss cheese-like areas in the breast and in so many areas which are only just ectatic ducts? So everything that is cystic is not necessarily, and appears to be large and occupying a space, is not necessarily neoplastic. So I think it's a difficult question. If it is non-neoplastic, then it is some kind of vascular disorder, perhaps. All right, and it is benign. That's all that we know. And if it is a vascular disorder, then it is an ectasia. Now, ectasia of what? Almost all of you were right. You call these lymphatics, okay? And why are they lymphatics? Because they don't have. It is lined by a vascular space. It is lined by endothelium. So yes, it is a vascular space, and it is a lymphatic because there are no red blood cells in it. It's only a coagulum. Okay, so it could be an ectasia. It could be equally, it could be a neoplasm, but whatever it is, it's benign, and these are vascular spaces. All right. Now, what's our next thing? Now, this is a well-known condition in the tongue, okay, and it is called lymphangioma circumscriptum. And I don't know whether it is truly neoplastic or it is an ectasia. Whatever it is, we know that it is benign, and this is the name that it has been given for years on end. All right, so it is lymphangioma circumscriptum. Is that the diagnosis that all of you had made? Yes, it's a very typical thing, and you get this, sort of proliferated epithelium. That's the squamous epithelium of the tongue, and you have these lymphatic spaces in between. All right, let's go now to the next one. Now, when we come to this one, which is one of the cystic spaces, is it epithelium, is it endothelium, or is it stroma? There are only three things that can line a space. And if it is stroma, what would you call it? We know if it was endothelium, it is an angioma. It could be an angiomatous malformation. It could be an angiectasis, like in a lymphangiectasis or whatever. If it is stroma, what would you call this space? A cystic space. Any one of you? Can you get a space lined by a stroma? By stroma? Is it possible to get a space lined by stroma? Answer should be simple, no? Yes or no? Yes or no?
Pseudocyst.
Yes, it is a pseudocyst because by definition, a true cyst must have a lining, all right? And that lining has to be one of three ileums, okay? It has to be epithelium, it has to be mesothelium, or it has to be endothelium. That's what these true cysts are. And of course, if it happens to be in the central nervous system, then you have a space lined by what? What is there's the choroid plexus, and then there is the, you have the ependyma, right? So it could be an ependymal cyst. But if you're talking about anything outside the central nervous system, these are, you have ileums, so mesothelium, endothelium, and epithelium, and then you have a stroma, and if it's the stroma, then it is a pseudocyst. Excellent. So now what is the lining of the cyst? Anyone? There must be a hole. And everybody must get it right. 100% should say what? Yes, it's a flattened epithelium. That's the choice that you have. So it is a flattened epithelium. Okay, good. So obviously it is acquired. Yes. Then it has to be, is it physiological or pathological?
Pathological.
Pathological, okay. Neoplastic or non-neoplastic?
Neoplastic.
Very good, neoplastic. Is it benign or malignant?
Benign.
Very good. So it's benign. And if it's benign, there's no question of it being either primary or secondary. So what is it?
Primary.
Yes. And this is a serous cystadenoma of the pancreas. You can see that this serous cystadenoma of the pancreas, as it is called, contains what?
Glycogen.
It contains glycogen, yes. And that's why you see this beautiful PAS. Yes. And this is after diastase has been added to it, okay? So please remember that when you do a PAS, if you're wanting to demonstrate glycogen, you need 2 slides, okay? If you want to demonstrate any other carbohydrate, you need just 1 slide, okay? So on which you add the Schiff's reagent. Very good. So this is a serous cystadenoma of the pancreas. All right, now who's going to take 2? Number 2. Who's next over there? Next to, in my little picture, there is Insha. So come on, Insha.
Case 2A is a 46-year-old male. Biopsy of the mass at the gastric fundus.
Okay.
And 2B is a 66-year-old male. Biopsy of nodular gastric mucosa.
All right. So it was 2A, 2 and 2A. It hardly makes any difference, but that's basically what it is. Okay. Very good. So let's go to the. Yeah, come on.
Ma'am, the first picture, the lower part of it, I can see some gastric foveolae that are present. After
Yes.
that, there is I cannot make out. There are just some tightly packed.
Right. This is very low power, so you can't make out anything much. But there is one thing that you can tell, and that this is gastric mucosa, right?
Yes, ma'am.
Yes.
Yes, ma'am.
Very good. It's not colonic
Yes.
mucosa, is it? Do you
No,
think
it's
it's
gastric.
colonic mucosa?
Ma'am, I cannot see that much. I can just say it's a mucosa
You
because I
can't
cannot
see
really
that much. Okay. I can see more than that much because there is no way that this can be colonic mucosa. And now, who's next? I can see Sumanna. Sumanna, even at this part, is this colonic mucosa?
No, ma'am, this is not colonic mucosa.
Why?
Because, ma'am, if it is a colonic mucosa, there is some
villi.
intestinal villi or some goblet cell is there present, was there present. But
It's
in
too
this
low part to see whether there are goblet cells, no?
Villi is the only thing that is not there. Basically, the projections
Villi
are
are
not
not
there.
there. Okay. But you know what I can see? Anybody? Yes, Prashant, you want to tell me why? You want to tell her why this is not cannot be colonic mucosa? Why?
In
Very good. Yes. Come on, Prashant.
ma'am, in colonic mucosa there are parallel crypts, colonic crypts,
There are
but
no crypts.
these fovea are not parallel. Yes, ma'am.
All right. What's the difference between a crypt and a foveola? Prashant?
Uh,
Are they two different things? Crypts?
yes, ma'am.
Foveoli? What's the difference?
Yes, ma'am.
Yeah, what is the difference, Prashant?
In the colon, we call it crypts, and these crypts are lined by columnar cells admixed with goblet cells.
All right.
But
Very good.
But in case of fovea, uh, 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 there will be a strong columnar cell, but we can't see it. There is no any goblet cells over there.
All right. So that's all. It's about goblet cells, no? Anything else? Yeah, you want to take a stab at it, Insha?
Ma'am, probably the muscle like.
In a minute, I will tell you, I will show you why this cannot be colonic mucosa. Because, yes, the essential difference is between a crypt and a pit. Pit or a foveolus, whatever you want to call it. Yes. Yes, any other person? Vignesh has disappeared from my scene. Now let me see. Is there a yes? So now just look at this mucosa, and you will see a clear line. Now you follow my arrow. Yes, you see something above the superficial to the line, and you see something deep to the line. And now I'll take off the line, and then you please look at it again. Can you see a distinction? You can see a distinction. This is the line, and I will draw it again. All right, here is this line. You can see. Can you see it? And then I'll take it off again. And you can see something that is superficial to the line. It's all epithelium. All right. We're talking about the mucosa, but there is an epithelium that is above the line, and there is something else below the line. And what is superficial to the line, we call superficial epithelium. And it ends in a foveolus or a pit. Okay, so you see the pits over here? I will mark them with dots. That's a pit. This is a pit. The pit has gone on the line over here. There's another pit. There's another pit. You can see the pits. And something below this line, deep to this line, and I'm taking off the line now. I will mark the pits. Yes. Now I will mark the pits. Here's a pit. Here's a pit. Here's a pit. Here's a pit. 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 Can you see the pits? And if you join them, that would have been the line. And what is deep to the pits? What is deep to the pits? Those are glands. Okay, and the glands have a completely different epithelium depending on whether it's the body or it is the antrum or it is the cardia. Those glands are either oxyntic, that means it is an oxyntic epithelium which has both pepsin as well as acid secreting epithelium, and those glands open into the foveolar pits. Okay? So do you see that line now? And I'm going to take this, clear this, and please get it into your heads. You can see it very clearly. Now, what happens in the colon? A colon has crypts, and those crypts are the glands themselves. So they're long tubular glands. The bottom of that gland is called a crypt, and nothing opens, no other glands open into that crypt. So although crypt means something that is at a deep level, it's below the earth, no? That's why we call it a crypt. Crypt is something that is hidden underground. That is what the meaning of a crypt is. Now, a pit is also in the ground. No, we dig a pit into the ground. But although these two things might mean similar things in the English language, we use it in professional language, like you use pit or foveolar epithelium because the deepest part of that foveolar epithelium is the pit, into which the glands that are deep to it open. Do you understand this now? This is the difference. So the moment you see this, and you see this line that is running, and I'll draw it again. Okay, see the distinction. What you're seeing below are the glands, and this is the line that connects the connects the pits into which the gastric glands are actually opening. So please, even at low power, you cannot mistake this for colonic epithelium. And a colon never becomes stomach. Okay, the stomach can become colon-like. All right. Now, having said this, would you like to tell me what is present in number 2? 2B. Yes, Insha. We said that they said that the stomach, right?
Yes, ma'am.
Yes, ma'am. Now that we know what stomach should look like at low power, what are you seeing here?
Here I can see these are gastric.
When you look at it, look at the length of these. First of all, these what look like. See, you can imagine, but you can see they're becoming almost test tube-like, right?
Yes, ma'am.
So there is something funny happening over here. That's what gastric epithelium should look like, and we are beginning to see something else. Yes, we are seeing. Now, if you go and look in this area, you have got some glands there at the bottom, yes, in this area, and they are opening into foveolar pits. But a lot of this gastric epithelium is no longer looking like gastric mucosa. It has changed. Yes. Now, that is something that we have to be aware of even at low power. Yes. Okay. Now you can see it much better, but I wanted you to notice that this is something that you can see straight away, even at, and now you can see this. I was drawing that line. So these are the glands that you are seeing down there. Let me just take a thing. And this was the line that I was drawing. Yes. And these are the pits. You see, all these are pits. And I was drawing that line, and you're seeing these glands underneath now at higher power opening into those pits. But what are you seeing here? Yes, there are glands, but look
Yes,
at the
ma'am. But there's a change in the
they're becoming different, and
morphology.
you're beginning to see that there are goblet cells that are.
Goblet cells.
Now that's very interesting, isn't it? It is. We are told that it is stomach, and yes, we have to believe that it is stomach because it still retains some of the architecture of the stomach, particularly of the underlying glands. You see, all these little things over here are glands. All this area is a gland. This is the foveolar epithelium getting into the crypts, and you can see that these into the pits, and the pits are branching. Okay, so branching foveole. Yes, somebody wanted to say something.
Yes, ma'am. The right hand side, I feel the right hand side of the slide has a lot of glands, but then as we go towards the center of the slide, I feel that there are less of glands, probably atrophy of the glands here.
Maybe, I don't know. We'll have to look at it at a little higher power. All right. Now you begin to see the goblet cells over here. Very
Yes,
good.
ma'am.
All right. So you want to now continue
Yes, ma'am.
describing?
Yes, ma'am. Should I start from the first picture or should I continue with the second picture?
No, come on. Yeah, whichever you
First
want to. You
picture.
want to. Yeah.
Ma'am, the
2A.
first picture, 2A, basically now shows us the gastric foveolae and the gastric glands which are present underneath. And below, we have these tightly packed cells that basically they look like they have a round nucleus
Okay.
and they have an eosinophilic. So they're probably parietal cells that are present together, a
Fine.
group of
Okay.
parietal cells that are.
All right. What about this in 2B?
2B, ma'am, I can see on the right hand side lower part there's this gland looks like it has underwent intestinal metaplasia. There are goblet cells and there's a mucin bluish tinge that I can see.
Okay. Very good.
And
Is there anything else you see?
I think I can see neuroendocrine cells, a few of the
You
neuroendocrine
can see
cells.
neuroendocrine cells. You've made an interpretation. Would you like to describe that?
They're like these dark blue color round nuclei with a clear halo around them. The cytoplasm is little clear.
The cytoplasm is very clear. Would you like to show what cells you are describing? Can you use the
Yes,
pen?
ma'am.
Cytoplasm, the only cytoplasm that I can see that's very clear is these. And these are goblet cells. So where is your cytoplasm that's very clear? Can you use the pen? That. Okay. So you think that these are neuroendocrine cells. Yeah? Let's clear this whole thing. And you mean these. Yeah? This whole group of cells. It's very odd, no? Do you think that these could be just neutral mucin
Not
like
the
you
whole-
see on the other side? Now I'm drawing this on the other side, which is gastric mucosa. Yes, and in 2A, and you can see those clear cells. And those clear cells are nothing but neutral mucin, which is being
Ma'am,
seen
but they have a basally located nuclei, whereas here the nuclei is a little bit in the center.
Oh, in the center. I don't think that anything is in the center. This is all at the periphery, and now you'll have to tell me why it looks like that. If you don't tell me, one of the others will. Yes, Vignesh? Huh? And you can look to the right and you can see this. Right of that, and you can see this. Okay? And it looks exactly like what you're seeing here. So, what is it? Yes, Sumanna?
There's a little bit of stratification that's happening.
It's not stratified.
I can see intestinal metaplasia.
Oh, you can see intestinal metaplasia. I think she's confused by why you feel that there are 2 or 3 layers over here and similarly over here. Sumanna, Vignesh.
Yes, ma'am. It is due to that cut, ma'am.
It is an oblique cut. So this is an oblique cut. So this is not anything there. Is there anything else that you see? What do you think these are? Are they glands? Are they the bottom of some glands, or what are they? Huh? Anybody? Yes, somebody called Raghav Kapoor said that it was a plane of cutting. Yes. Manisha Ayub says EOS. What is EOS? To me, EOS means the dawn. She's the goddess of dawn. Is that what you mean, Manisha? EOS? I don't know. You said atrophied glands. Well, one good explanation, maybe they are atrophied glands. Let's see what they turn out to be. Okay, let's go to the next thing. Now here there are more of them, except that now you can see them. You can take whichever you want. You want to take 2B first, and you can show. Eosinophils. Shefali says that EOS means eosinophils. Okay, thank you, Shefali. I didn't know what EOS. Maybe that's to me. EOS is the goddess of dawn. Okay, she's EOS, the goddess of dawn. Okay, now come on. So Manisha, sorry, not Manisha, Insha, tell me what's on the left and what's on the right.
This picture, ma'am, is showing us the first picture is again those tightly packed parietal cells, and I think there's a thin line of muscle that is present that is separating the left side of the slide from the right hand slide.
Okay,
The right
very
side
good.
is just some. Uh, there are cells that are present which have lost an architecture. Basically, they're not showing any particular pattern, but they're just present randomly, but they're
One
not
minute.
well organized like
You
the cells in
cannot
the
say
other
that
cells.
cells have lost their architecture unless you knew what the architecture was. Do you
They
know
don't
what
have
the
any.
architecture was and now they have lost it? What does that mean?
No, they're not showing any pattern. They're not showing any formation
So
exactly,
not
but there are
showing
just a lot
any
of cells.
pattern doesn't mean that they have lost an architecture. Okay, so when something has no pattern, what do we call it? What kind of
Sheets or solid
Sheets.
sheets of
sorry?
cells. Sheets of
Yeah,
cells.
so solid is one word. It's not cystic, I know that. But even
Sheets
a
of cells.
solid thing can have an architecture. It can be nested. It can have other patterns, yes? Nodular, nested. So what is this pattern that we talk about where you can't see a pattern?
Sheets.
It's a sheet. So you have got a sheet. At least at this far, you see that there is a sheet of cells which is deep to the
The
muscularis
muscularis mucosa.
mucosae, because on one side you have, as has been rightly pointed out, this side is, you see the glands, gastric glands. This side you see this is the muscularis mucosae, and on this side you see sheets of cells. Okay, right. Okay, so you've described that. And what is happening over here?
The other picture, ma'am.
Yes, 2B.
To
This
be, I
picture.
can see the right side is showing us a lot of goblet cells, the right hand side of the picture,
Yes.
intestinal metaplasia.
Yes. And there's something different, isn't it?
there's
Yes.
something
So what is
different.
that something different? You want to describe it? This is the something different.
These glands don't have a lumen, as
Now,
in
number one, you are making an interpretation that this is a gland. Will you please describe it in your head and then articulate it to me? Huh?
they're just cells
Why
present.
are you saying that it is a gland? Over there, you said it had lost its architecture.
Yes.
I think that this is laziness of the mind. Let's call it a gland. No, not let's call it a gland. Insha, we have to think. No, there are patterns. We have been told by our teachers and betters that we can actually articulate what we are seeing. The moment you articulate this in a word that is appropriate, then it triggers a thought. So now, how will you describe this, which is an abnormality. It is an abnormality.
It's a
Yeah.
nest problem, ma'am, a nest of cells.
Aha. So this is one nest, and that is another nest. Yes. So you have got nests of cells. That's a sheet. This is a nest. Very good. So now tell me, what are those nests composed of?
They have round blue hyperchromatic, a blue color nuclei, and
Nuclei are pink, are they? So that we have to say that
they have a round nuclei.
they are round nuclei.
Yes, ma'am.
I think I'm either I'm a little
Round to oval, ma'am. There are a few round nuclei and a few oval nuclei.
Okay.
And the cytoplasm
Which
is
are more numerous, oval or round?
oval.
So they are round and oval nuclei, right? Yes, and there's something else, no, which you saw in the other nest. Huh? What? The nuclei there are round?
They're oval to
So they're oval and actually becoming a little spindle, right?
a spindle, yes, ma'am.
Their length is coming to be almost double its width. So there must be, there are oval cells. Look at the number of oval cells. There are oval nuclei rather. They have pink cytoplasm. You may not be able to see the outlines very well. Okay, but there is pink cytoplasm. There are oval nuclei. Some of them are becoming spindly, and yes, some of the nuclei are round, and they are nests. And there are nests that are sitting in between the gastric glands. Here's one gastric gland. You can probably see the outline over here. This one is a bit disrupted. You can't see, but they are in between the gastric glands. Now, if we went back to this previous slide, you're seeing the same little nests here. Here you may feel that there is a bit of a lumen, but they are the same character as what we were seeing here, and you are seeing some of them which actually have a lumen. So we're not imagining this. Same nuclei with a small lumen, and here a lumen, here lumina. Here's another one with a small lumen, but there are also solid ones which don't have lumina. And you go to the next thing, you see the same thing. This is just a larger nest of this kind. Very good. I'm getting all kinds of yes, somebody said nested pattern over here. Who's that? Samriti Arora. Very good observation, Samriti. Now here we are. This is the high power of 2A. And what does it show you? Any pattern? Now we're at high power.
No, ma'am. It's showing the solid sheets of cells.
Yes, so it's sheets of cells. Okay,
yes. But they're of different shapes. Like a few of them are oval in shape.
You're talking about the nuclei. Young lady, you're talking about the nuclei. You're not talking about the shapes of the cells. You are talking about the nuclei, because you can't really see cytoplasmic borders, can you, to describe what these are? But since the nuclei are oval, some of them are a little spindly, yes. But what is interesting is that, you can see some spindle nuclei, then there are some oval nuclei, they are in sheets. What do you want to say about when you look at cells, okay? You look at groups of cells, patterns, etc. You get a feeling, no? Am I looking at something that is epithelioid? Am I looking at something that is mesenchymal? Am I looking at something that is round cell? Am I looking at something that is hematolymphoid? Yeah. Am I looking at something that may be glial or whatever? So what is the impression that you get when you look at this? Do you think that this is round, sir? Do you think it looks mesenchymal? I'm giving you options, so yes or no. So is it round?
No, ma'am.
No. Is it mesenchymal?
Could be mesenchymal, ma'am.
It
Because
could be mesenchymal. All right. Is it epithelioid?
epithelium generally has a property of cohesion. They stick together, so this
Oh,
doesn't look
is this falling apart, or is this cohesive?
They're not cohesive, ma'am. They
You
are
don't think it's
separated.
cohesive? Okay. Anybody agrees or disagrees? How do you know that something is cohesive? You want to look at the right-hand side and tell me what you think on 2B? Is this cohesive? Is this not cohesive?
Sorry, it can be cohesive, ma'am, because here we are not able to make out the cell border. So actually everything is present in a syncytium. So it could be cohesive. This could be epithelial as well.
It is cohesive, but
Yes,
you're
ma'am.
getting this odd feeling that because of these oval cells, some
I think there was some problem again with ma'am's connection. We will get her back. Let's see. Ma'am, are you back? Okay, I'll have to go out again to bring back ma'am back. Just hold on for 1 minute.
Yes.
Hello, ma'am. Can you hear us?
I'm back.
Yes, ma'am. Thank you.
I'm sorry, I'm having a lot of troubles
Yeah.
with it.
It's okay, ma'am.
All right, so now you get this peculiar feeling that this is epithelioid, but the one on the right is even more epithelioid than this. Okay?
Ma'am, your video is still not turned on, ma'am. If you can just turn on.
Video is not okay, but you can hear me.
We can hear. We can hear.
Yeah. Okay.
Hello.
Yeah. Okay. So now we have got two things that look epithelioid. The one on the left, that is 2A, is looking both epithelioid and possibly mesenchymal. Excellent. Right. Do you want to say anything about the difference in the nuclei?
Ma'am, the right side is more of a uniform looking nuclei. They're all round
Yes.
nuclei that is present in the center of the cell.
Okay.
Whereas
Yes.
the left hand picture has nuclei that are of different shapes. Some are oval in shape.
Yes. Some are spindly. Yes.
Yes, some are
Spindle.
elongated, spindly shape. And
they are indented. They have all kinds of different nuclei. All right. Good. Anybody thought of any diagnoses? I think I have to pull this down. And there is a poll, so you may look in your poll if you can, because this I'll have to turn the whiteboard off, whichever, so that you can see. Yeah, all right, come. This is not a poll, but there are questions. Yeah, Ninja, can you hear me?
yes, ma'am, I can hear you now.
Yes. So shall I do it for you? Yes, this is gastric body mucosa. That was gastric antral mucosa. Yes.
Yes,
okay.
ma'am.
Is there any abnormality seen?
Yes, ma'am.
Yes. On the left-hand side, the epithelium was essentially normal, right? In 2B, there was intestinal metaplasia.
Metaplasia.
Right. What is the relationship of the normal to the abnormal? Here you had the abnormality in the lamina propria, and there also in the lamina propria, except that there was also an abnormality that was deep to the muscularis mucosae, right? On
Yes, ma'am.
2A? Yes,
Yes, ma'am.
that's right. All right. There you had sheets of epithelioid. Here you had nests of epithelioid cells, if you were asked about. And the next thing is, of course, where should you direct your high power examination? Okay. Okay, here's a little bit more. The cells have a moderate amount of light eosinophilic cytoplasm, oval, irregular, bland, pale, vesicular nuclei, and no mitoses. Here, small, medium-sized, eosinophilic cytoplasm, dense nuclei, and the mitoses are, there are no mitoses. Okay, good. There is an inflammatory response on the right side in the lamina propria, but there is no inflammatory response seen on the right side. You didn't see anything that was an inflammatory response. Okay, now this was in my orthodontist's waiting room, and it said, a gum-chewing kid and a cud-chewing cow. They are the same, yet different somehow. Yes, I get it now. What's the difference? It's the intelligent look on the face of the cow. Okay, so anybody who chews gum is not terribly intelligent. So why did I put this up over here? Because there are many similarities, but there are many differences. Okay, and you can start right from the beginning. This was a mass lesion. This was just nodularity in the stomach. If you read the history, here there were sheets, here there were nests. There were intermediate size cells in 2A, and there are small cells in 2B, in the sense that the nuclei are small and the cells are not large. And intestinal metaplasia and inflammation. Yeah, so I've shown you the two pictures over here, and you can compare them. Very good. So now, what are your thoughts? Did you have any of these thoughts? Okay, so what thoughts? Did you think of NET? Well, you have to choose. You have to have NET. Is it a carcinoma? Is it a melanoma? Is it a soft tissue tumor? Is it a lymphoma? And on this side, I don't think any of those things apply, except for neuroendocrine hypoplasia or neuroendocrine neoplasia, maybe a NET. That's neuroendocrine tumor. Good. So now, anybody wants to take a pick? Come on, Insha, what will you think about in 2A? Did you have any diagnosis?
Carcinoma. Poorly.
You thought it was carcinoma. Okay, very good. What about you, Sumana?
Soft tissue tumor.
Soft tissue tumor. Very good. What about you, Vignesh?
I think it's a poorly differentiated or a neuroendocrine tumor.
Poorly differentiated neuroendocrine tumor. Okay. And Prashant? Prashant, any preference? Yeah, Prashant? No preferences at all, Prashant? Can you hear me? No, I don't think Prashant can
I
hear
think
me.
it's carcinoma.
Oh, you think it's carcinoma. All right. So we have two carcinomas. We have tumor, that too poorly differentiated, and we have Sumana. Okay. Now let me see if there's anybody.
A very close poll, ma'am. So almost 30% each of the students thought that it is NET and carcinoma, and 24% went with soft tissue tumor.
All right. So there is, it's like a third, 1/3, and 1/3. Okay. That's good. Okay. Now we have to do some immunohistochemistry, right? Now here is CK, that's A1, A3. And this is for 2A. Huh? All these immunos are for 2A. So it's not a carcinoma because there is no cytokeratin. This is SMA, and there's no, it's not a mesenchymal tumor or a soft tissue tumor. So Suman, now it is not a carcinoma. You thought it was a soft tissue tumor. What soft tissue tumor did you think it was?
And gastrointestinal stromal tumor may be a possibility.
Gastrointestinal tumor. Oh, that's one of the tumors in the stomach.
Yes,
So
ma'am.
now that the CK is negative, yes, that means, so Vignesh, is your poorly differentiated neuroendocrine tumor diagnosis?
Yes, ma'am.
Does it still remain a differential diagnosis, Vignesh?
Yes, ma'am.
The other two said carcinoma, so they are out. What about neuroendocrine tumor? Is it still a differential diagnosis after the CK is negative?
Yes, ma'am. Because not.
Yes.
Yes.
Why? Because what neuroendocrine tumors, are they CK positive or negative? Are they tumors of epithelial type or not? Vignesh, what do you think? All right, Insha, tell him. Does it still remain a differential diagnosis, Insha?
No, ma'am.
No, ma'am, because all neuroendocrine tumors,
Are
however poorly
not.
differentiated, should express cytokeratin. Okay, so those who said neuroendocrine tumor, those who said carcinoma, have to think again, because here we are with the A1, A3, and it is not there. Okay, so we had three differential diagnoses, and two of them are out. Very good. So now we have to ask, what sort of soft tissue tumor is this? So when we think of soft tissue tumor, we do 4 stains. Okay, if it is soft tissue in the rest of the body. So we did SMA, it was negative. Here we are doing S100 protein. And is it positive or negative, Suman, now?
Ma'am, negative.
Negative. What are these little brown spots? You can see. What are they? They are S100 protein positive. They are showing nuclear positivity for S100 protein. So what are they?
Schwannoma.
Schwann, you think this is a schwannoma now? Because there are a few, you told me that the was negative. So then, is it negative or is it positive? Come on, make up your mind.
Madam, ma'am, I prefer it is negative.
It's negative. So then what are these S100 protein positive cells? Carefully, you see this S100 protein positive cell?
Ma'am, there are some spindle cell.
Yes.
Most probably these spindle cell are positive for S100.
I know that they are positive for S100. Now,
excuse me, ma'am.
What are they? I know that they are S100 protein positive. So what are they? The tumor you see in the background is negative. So what are these cells? Anybody?
Fibroblast.
Fibroblast would be S100 protein positive. Prashant, what is S100 protein positive? Can you tell me what cells in the body are S100 protein positive? Do you do any immunohistochemistry in your Prashant? Yes, I think Prashant can hear me. Come on, Vignesh. What are the cells that are S100 protein positive?
Ma'am, Schwann cells, neurons,
Yes.
melanocytes, and then
Schwann cells? Neurons. Neurons. What neurons?
like dendritic cells.
What neurons?
Like dendritic
Yeah,
cells.
okay. But are neurons S100 protein positive?
Yes, ma'am. and then
Yes. Are
sometimes
neurons S100 protein positive? Vignesh, don't sidestep the question. Are neurons S100 protein positive?
yes, ma'am.
Are they?
Yes, ma'am.
Really? Where have you seen neurons? You stain them in the brain. Will they be positive? Huh? No. So you mean Schwann cells. The axon is a process of a neuron, is it right? Yes or no?
I think no.
The axon is the process of the neuron, is it yes or no?
Yes, ma'am. Yes, ma'am.
Yes. So is it positive? No. It is the Schwann cell that is wrapping itself around the neuron, the axon, that is positive. So it is Schwann cells, yes. Dendritic cells, yes. What dendritic cells?
Especially the tissue dendritic cells and the tissue dendritic cells.
Yes, very good.
And then
yes, there are dendritic cells, no, that are related to the Langerhans cells.
yes, ma'am.
There are other dendritic cells. There are
interdigiting dendritic cells.
histiocytes. Yes, very good. So, and histiocytes are often S100 protein positive. You know that, no? The histiocyte in sinus histiocytosis with massive lymphadenopathy, that in Rosai-Dorfman disease is S100 protein positive. So these are probably some tissue dendritic cells that are present over there. Okay, so the whole tumor is S100 protein. Is it positive for Desmond, Sumanta? Is it? Yes or no? This is Desmond, Sumanta. Is it positive or negative? Can you hear me, Sumanta? Or maybe she can't. Yes, anybody else? Is it positive, Sumanta? Desmond? No, I don't think she can hear me. What about Insha? Is Desmond positive?
Negative, ma'am.
Negative. Desmond is negative. Excellent. So no SMA, no Desmond, no S100 protein. This is CD34. So we do 4 stains, I said no in general. So we do SMA, Desmond, S100 protein, and CD34. And is CD34 positive or negative? Sumanta? Is CD34 positive or negative? Positive or negative? CD34. Yes.
Positive.
I can hear you, Sumanta. So is it positive or negative, CD34? She's still thinking. Yeah, Vignesh, is it positive or negative?
CD34 is positive, ma'am.
Yeah, it is very strongly positive. You can see that. You can see the membrane as cytoplasmic positivity. Oh. And what is there on this side? This is c-kit. Okay.
Yes.
So what is this tumor? What is this tumor? It is an epithelioid gastrointestinal stromal tumor. Okay, so Sumanta was right. This is a mesenchymal tumor, and you could tell that because.
Hello, ma'am.
Sorry? Yes?
Ma'am, my name is Sumona, not Sumanta.
Your name is Sumona.
Ma'am?
Because they've given
Yes,
it
ma'am.
as Sumanta. So what are you?
No, ma'am. My name is Sumona.
Sumona.
That's why I'm a little bit confused.
All right, but there's nobody else in this thing who has a name even close to that, Sumona. It's okay. Sorry, I've been mispronouncing your name, but it was given to me as Sumanta. Okay, so Sumona. Good. So is it positive or negative now? So what is the diagnosis? It's an epithelioid cyst. Okay, very good. Now we come to 2B. And you have to answer this poll. Are these two sections stained for cytokeratin? Okay, are they stained for cytokeratin? Yes or no? Come on, Sumona. Is it yes or no?
Ma'am.
Is it stained for cytokeratin?
Yes.
Yes, all right. Next.
Yes,
Who's
ma'am.
there? Insha. Is it stain for cytokeratin?
Yes, ma'am.
Yes, ma'am. Or Vignesh has disappeared from my screen. Yes, Vignesh, is this stain for cytokeratin?
Yes, ma'am.
Yes, ma'am. What about Prashant? Prashant, is it stain for cytokeratin?
Yes, ma'am.
Yes, ma'am. So all four of you have stain for cytokeratin. Excellent. Now,
In the poll, ma'am, we
who
had
say
totally 50-50 division. So 51% for yes and 49% for no.
all right, good. Now, let us break it down, my friends. What does cytokeratin stain? Anyway, and now all of you, one by one, quickly. Vignesh, what does cytokeratin stain? Vignesh, what does cytokeratin stain? Yeah. What does cytokeratin stain, Vignesh? Can you hear me? Prashant, what does cytokeratin stain normally?
Normally,
Or let
epithelium,
me put it
ma'am,
the other way. Cytokeratin is expressed by what?
by epithelial cells, ma'am.
Epithelial cells. Prashant, very good. Insha, you agree with Prashant?
Yes, ma'am.
Yes. Sumona, you agree with Prashant?
Yes, ma'am.
Yes, ma'am. Vignesh, you agree with Prashant?
Ma'am, I can't get, ma'am. I think my signal is bad.
Cytokeratin is expressed by what? By what
Epithelial,
cells?
epithelial cells.
Very good. Epithelial cells. Now, please identify the epithelial cells in these two sections. Okay? And you start. Vignesh, please take your pen and draw any epithelial cell that you might see in this section. Come on. You got your pen, Vignesh?
Ma'am.
Vignesh, you got a pen?
Yes, ma'am. Yes, ma'am. I got it, ma'am.
Very good. So on the left-hand side and the right-hand side, will you please draw any epithelial cell that you see? You drew?
Yes, ma'am. I don't. Green color.
Ah, okay, you drew some epithelial cells over there. All right. And draw it on the left-hand side. I
Yes,
see. Okay, very good. Now, can I draw some epithelial cells, please? Am I allowed to draw epithelial cells? Are these epithelial cells? Are these epithelial cells, Vignesh? All these things, are they epithelial cells?
Yes, ma'am.
Yes or no?
Yes, ma'am.
All this, epithelial cells? So are they stained?
No, ma'am.
Yes or no?
No, ma'am.
No, ma'am.
No, ma'am.
Oh, ma'am. Yes. Is this all these are epithelial cells on the other side? Oh, there are any number of epithelial cells. Huh? Are they all stained with whatever stain that we have used?
No.
Yes or no?
No,
No,
ma'am.
ma'am.
No. Then why did you all say that this section is for cytokeratin? So you are part of the 50% who said yes, and the answer is
No.
what? What is the answer?
No.
No. Okay, so see, it is chromogranin. Okay, it is whatever it is not an epithelial cell. Okay, and we said that the most likely diagnosis in 2B was neuroendocrine tumor. Yes. So what is being stained? Everything that was the tumor has been stained, but not the other epithelial cells. Okay. Yes, all neuroendocrine tumors will stain with cytokeratin. But if you're not using an antibody to cytokeratin, then obviously the rest of the epithelial cells will not stain. Yes, and we are using here an antibody to chromogranin. And what are then these? What is on the right hand side? What are these cells that have taken up the stain within the epithelium? What are these cells?
Neuroendocrine cells.
Yes, they're neuroendocrine cells. And do you normally see so many neuroendocrine cells in the epithelium? Somebody called Maniza, Dr. Maniza Ayub says that this is the internal control. She's right. There are always epithelial, there are always endocrine cells in the stomach. But do you see so many of them? No, you don't. What's happening over here? Why are you seeing so many neuroendocrine cells, and why are you seeing what is obviously a neuroendocrine tumor? There's a neuroendocrine tumor over here, and there are multiple little cells in this epithelium. So can you put 2 and 2 together? What is happening in this epithelium? Everybody is saying net, and there are 2 people who have said, one is Samriti Arora and the other is Swaroop Natra. They have said that what is being seen on the right hand side is neuroendocrine hyperplasia, and on the left you are seeing a neuroendocrine tumor. Okay, so you have got, see, there is, sorry, let me take this off. You're seeing chromogranin on one side here, and you're seeing synaptophysin on the other. Okay, and you notice that there is some neuroendocrine hyperplasia, but the moment these, and you see the little nests also on the, you know, which we saw that were all running around between these foveolar and glands. You see these things? Yeah. So this is a carcinoid tumor, okay? And you saw that in the last slide. And what you're seeing here is what is sometimes called carcinoidosis, because there are multiple little islands of carcinoid tumor, okay? And there you saw chromogranin, and here you're seeing synaptophysin. And if you interchange them, would I know which was chromogranin and which was synaptophysin? What's the answer? The answer is no. I would have to have my technician tell me whether they have dropped synaptophysin on the slide or they have dropped chromogranin on the slide. Otherwise, I can't tell the difference. Because why is that so?
Membrane staining in both.
Because there's membrane staining in both. No, both will give me a brown stain. Why? Why are they both giving me a brown stain? Why doesn't one give me a green stain and the other one give me a brown stain? Or a blue stain, or a red stain, and the other one a brown stain. What is the brown color due to? What is the brown color due to? What is the brown color due to? Many people are saying cytoplasmic staining, and they stain neurosecretory granules. True, but
it can be due to target.
Why is both? Yes, sorry.
It's due to target antigen. Due to? The brown color due to the target.
I targeted the antigen. One with antibody to synapto, the other one with an antibody to chromogranin. But why are they both brown? Huh? Why? What is this brown color due to? You mean both the antibodies are brown in color? If you look in the chat box, I can see in my chat box, people are answering the question. There's somebody called Lakshmi Priya who's talking about DAB. Somebody else is talking about DAB. So, what is DAB? Anybody know what is DAB? Anybody does immunohistochemistry in their labs? Answer? Someone? Yes? Sumana, you do? Progesterone, any antibody? Yes, you're doing? Sumana?
Yes, ma'am.
Yes or no?
Excuse me,
So
ma'am.
you're doing. So then you
Yes.
So what color is your estrogen receptor?
Excuse me, ma'am.
Estrogen receptor.
Excuse me,
What
ma'am. I
color?
color properly.
Do you do?
Ma'am, brown color.
Can you hear me?
Yes, ma'am.
Yes. Why is there a brown color?
No, ma'am.
Why is there a
I can't hear
brown color?
properly.
All right.
Hello, ma'am.
Then I can't. I think we've got a bad connection. Yeah. So do you know about diaminobenzidine? What is it? Yes, you're shaking your head, Vignesh. You've heard about it?
Yes, ma'am. That's DAB, ma'am. It oxidates the hydrogen peroxide and oxidase substance.
Yes, so DAB doesn't oxidize hydrogen peroxide. Hydrogen peroxide oxidizes diaminobenzidine and it produces a brown reaction product, which is called a chromogen. All right, because we see it. I cannot explain immunohistochemistry and how it will have to go and read it. Okay. So you cannot tell if you're using the same chromogen what you are seeing. You can't tell what is the antigen. You have to know what is that antibody because the chromogen is the same. Okay? Right. Okay. So now you see this chromogranin on the right side. You see chromogranin on the left side over there. And you see the small nests of cells. This is what we often call carcinoidosis. Okay? So this diagnosis is atrophic gastritis because there was atrophic gastritis with incomplete intestinal metaplasia, neuroendocrine cell hyperplasia, microcarcinoidosis, and a type 1 gastric carcinoid. Okay, there are so this particular case. It was similar to the other case. It both looked as if they were neuroendocrine tumors, but they were not. Okay, now can I say, is Gaurav over there? Gaurav?
Yes, ma'am. Yes, ma'am.
Right. Now, do you want to continue? Because we've got, or do you want, are they tired? Do they want to go the next time? In which case it could Wednesday or Saturday or whatever.
We can run a poll of that, ma'am, actually. And let me run a poll quickly.
Please run a poll. Immediately run a poll and tell me.
Yes.
I'm not hungry, but they are. And I can see that people are leaving the webinar. So if somebody wants to carry on, or enough people want to carry on, I'm happy. But otherwise,
so ma'am, almost
we can do it on a Saturday.
Almost 93% of the students have responded that they will like a part 2 on Saturday, ma'am, if that's okay with all of us.
Excellent. I'm fine on Saturday.
Yes.
So if somebody wants to do it on Saturday, and at what time? 7 o'clock?
7 o'clock, ma'am, same time.
All right. Will our 4 friends over here be happy to come back on Saturday? Vignesh, Prashant, yes? All
Yes,
right,
ma'am.
good.
Yes,
so
ma'am.
I'm sorry about this because I had a very bad connection. We wouldn't have had so many breaks. That very, it's not the fault of Webinar Jam or the moderators or anything. I've just lost my my routine connection and I've had to make do. Okay. Thank you all of you very much.
Thank you, ma'am.
Thank you, ma'am.
Okay, thank you.
Just before
Okay.
stop, I will just run this.
So I have to get my connection back because tomorrow I have a talk to give.
Yes.
Okay, I'll have to do something. Yeah, I'll go next door to my brother's house and I'll see how to get a connection. Okay, thank you.
All right. So, like you now know that we will continue this with next Saturday. So this Saturday, 12 December, we will have the part 2 of today's slide seminar. And in the meantime, tomorrow we will be again hosting Dr. Borges for the neoplasia talk 2. So I hope to see you all tomorrow at 7 p.m.
Okay.
So with that, I think we can end.
Once again, I apologize very, very, very sincerely for
No,
this
ma'am,
problem.
I think
Okay.
most of the time the connection is okay, and all of the students enjoyed. I think so. Really, thank you to you,
All right. Thank you.
all the 4 students also.
Okay.
Thank you. Bye. Bye.
Bye.
Thank you.
Thank you. Thank you. Thank